Welcome to The Age Guide, the podcast where we give voice to older adults and caregivers, challenge ageism, and offer guidance to help you thrive on the journey ahead. I'm Gretchen, your host. This season, we're diving into what it really means to age well, from keeping our bodies strong and our minds sharp to nourishing ourselves and building more inclusive and connected communities. I'm joined today by Bob Blancato. Bob is a longtime national advocate for older adults and president of the consulting firm Matz, Blancato and Associates, where he leads efforts to advance elder justice, strengthen nutrition and aging services, and combat malnutrition. He also brings these issues to life as host of his own podcast, Real Life with the Older Americans Act. Welcome, Bob. Thank you so much for being here today.
Thank you, Gretchen. Thanks for nice introductions. It's a pleasure to be here.
Excited to talk to you about this. It's the perfect time to be talking because you coordinate the Defeat Malnutrition Today Coalition and you lead the National Association of Nutrition and Aging Services programs.
Right.
So with all the nutrition-focused advocacy that you're involved in, it just feels especially fitting to talk during National Nutrition Month.
Mm-hmm.
I thought to start us off, just to kind of level set things, nutrition can seem really simple. Everybody needs to eat, right? But it intersects with health and equity and public policy in really complex ways. So before we dig into the details of all of that, can you help us understand a bit of the bigger picture? Why is nutrition such an important issue that it merits its own advocacy month and a coalition and a national association?
Right. Well, I sometimes I want to answer that question by saying, why is it not such an important issue? Because it should be. I mean, it is vital to so many different elements of people's lives.
Good point.
And we have spent lives in the policy world living in silos. You've got a nutrition silo, you've got a transportation silo, you've got a housing silo, a health silo. But the more you begin to examine the linkages that exist in areas and policy areas, the more you can find ways to build a broader agenda. And so when you start talking about the relationship of nutrition and health, it's prevention. Okay, there's your linkage. Nutrition is a component of prevention of chronic disease. It is an element of healthy aging, which is a goal that we all aspire to. It addresses in part. The equity question is interesting because some of the biggest inequities have come around food access, okay, and getting to the right. I mean, I remember I've said this many times, and I'll say it again on this opportunity. We need to shift the food pricing paradigm in this country. It is unconscionable that it continues to be so cheap and easy to get bad food, and so difficult and expensive to get access to healthy food. We've got, as a nation, have got to come to the realization that there is a relationship between good health and good nutrition. And, we also should recognize the fact that, the whole social determinants of health are connected to nutrition. They can interface with all the social determinants of health, whether it's healthcare, education, access, built environment, economic stability. They all connect. But for too long, even as long back as I've been working in this field, I still say, as really recently as today at my podcast, when I taped it, I said, when you go to a congregate nutrition program, it's more than just a meal, right? I mean,
Yes.
you're getting nutrition education, you're getting socialization, okay? All the things that add on to, the core piece, which was perhaps the meal. So
Mhm.
it is time we've reached this point of saying nutrition is a priority issue. And, as we'll go through this conversation, I see where there's opportunities to move it even to a higher level.
That's good. I'm glad there's some positives to focus on right now. Even though sometimes it feels like we're really under a lot of pressure and people are getting squeezed. There's been so many cuts. There's been a lot of things going on with, for example, the SNAP food program. But what you said really leads naturally into the big topic that's gaining attention, which is food as medicine, right? And you mentioned this. It's becoming more of a mainstream idea, I think, I hope, because it sounds like that connection is so critical. So, from your perspective, how are nutrition and healthcare interconnected?
Well, that is certainly one of the main areas that we're talking about because, lifestyle and nutrition interventions can reduce hospitalizations and healthcare, particularly for high risk individuals. But part of what is important is to get at it early. I mean, nutrition should be a lifespan issue. Okay? There's no question that the habits you learn early can carry on later in life. There's too many people who start off poorly with bad nutrition habits and then discover later that it could have consequences on their health. And so, you know, for example, we have this whole new effort now around anti-obesity and combating obesity, which is obviously something we should be doing. But how you do lifestyle support in that in that work is going to be very important. Food as medicine is moving in that area. You've got legislation that's pending, things like the Medically Tailored Meal Act and the Food as Medicine demonstration programs. So I think, and I hate to be cynical about this, but I've been in D.C. too long to not be sometimes. Sometimes it takes people in Washington longer to understand the obvious things that people in the field have known for a long time. But you know, it isn't only about food being medicine, because if you're talking about food as medicine, that means you missed a few steps along the way. Okay,
Mm.
because you should have been focusing on the things that could promote your health before you have to rely on food to do that. And
So you don't need the medicine, right? So there's a
right,
prevention piece that comes first. Okay.
exactly, exactly. And but I think it's a win-win in food as medicine for this reason. It's going to be an education and awareness raising effort as well as a policy change. But a lot of times, the policy needle moves based on how much awareness and education you provide people. And I think this whole movement is long overdue, and it's one that I think if we come at with nutrition security movement, which I think is something else that we must come to grips with, meaning nutrition security defined by having consistent access to and availability and affordability of foods that promote well-being and prevent disease. Okay, that's nutrition security. And you know we've taken a lot longer. I mean, countries around the world have addressed some of these issues, before we have. But what we have to do now is take the momentum that we're developing, and get more people aware of it. Have it be. I mean, this is not a pun, but have it be a kitchen table conversation. You know,
Sure.
because that's what it comes down to. And then
Yeah.
eventually, truthfully, if you can go to the food paradigm issue that I talked about earlier, this can be an affordability issue. Because if you change the dynamic and you make it easier to get access to better foods that people can afford, they will see eating well as a positive investment in their health. So there's a lot of ways this could all come together if momentum continues.
Yeah. So there's a lot of advocacy. There's a lot of kind of trying to create some consistent definitions, it sounds like, in the way that we're going to talk about this. What kinds of policies specifically do you think have the most potential to support this connection between food and health and prevention and all the things you're talking about? So, do you have some policies in mind if you had a magic wand?
If I had a magic wand, right? I would change a few things, believe me. But on this particular one, I mean, I think we need to go deeper in the food as medicine space. We should test out demonstrations. You may know this, and you probably do. The Older Americans Act nutrition program grew out of a demonstration project. Okay, they experimented in 7 states with what we now know to be the Older Americans Act nutrition program, and they realized it was scalable, in a way that could make it a national program, which it is today. And since we are still awaiting the reauthorization of the Older Americans Act, there could be a wonderful opportunity in this reauthorization to apply some of these programs and these ideas, whether it's food as medicine or whether it's, better nutrition education, into the congregate nutrition program as well as the home delivery meal program. So clearly, reauthorizing the Older Americans Act is one policy thing. I think now that we have new dietary guidelines that have been proposed, and They need to be strengthened for the older adult. We're not happy with the way they came out. But there's some ideas in there about flipping the food pyramid around and, promoting more protein and less processed foods. That can be built in. You know, how do you reimburse? What do you reimburse for? The Centers for Medicare and Medicaid Services issued what they call an RFI, a request for information, that included the possibility of creating new codes for social care services. Okay, not medical care, but social care services, which we know social care and healthcare are very interconnected. But if you started having access to a higher rate of reimbursements through these Medicare codes for things like nutrition and education, that would be a game changer. So
We're talking about reimbursement from healthcare
right, from
for
Medicare,
nutrition
from Medicare
services.
specifically, yeah, for social care services.
Wow. And what's a social care service?
Anything that you would, it's transportation, it could be nutrition, it's what the Older Americans Act does. Take its 7 titles and look at, the services it provides, and they all are social care services.
Yes.
That some people call them human services or social care. I think the term social care has reached a point where it's on more people's minds because they see it's connected to outcomes, which is the same thing in the healthcare space. But if you ended up having access to much more in the way of dollars than the Older Americans Act can ever provide, and it's tied to these services that promote healthy aging, we could see quite a change. If you combine to some degree this little initiative with the larger Make America Healthy Again initiative that they're working toward, nutrition is almost in the centerpiece of MAHA. And so you could blend it in to a more specific proposal that comes from MAHA. I mean, they've proposed this major new agency in the Department of Health and Human Services, like a separate agency for MAHA, which if you had that, you'd have a dedicated group of people focusing on nutrition. And, something like new codes for social care service could fit right in. But our job as advocates is to keep the eyes on all the things that are moving and try to get them to the right people, the right champions who can put forth the right kind of proposal that can get adopted.
Wow, it's exciting to hear that things might be moving in a positive direction right now with this
Well,
RFI that's out there.
and I'll tell you this. I mean, there's other things that we could look at that could happen this year that would impact the nutrition space. For example, if you expanded medical nutrition therapy beyond what it is now, which is just diabetes and kidney disease, into things like cardiovascular disease and things of that nature. You have a bipartisan bill to expand it to cover cancer, heart disease, malnutrition, and obesity. Now, and I know that providing the proper kind of counseling to people can lead to making the right decisions on what you eat and when you eat it and how you eat it and so on. And there's a study that came out once the bill HR 6199 was introduced. They had a study that said that MNT, if you expanded it, would save at least $33 million in savings in the first year from fewer hospitalizations and outpatient visits.
That's a
So
good outcome.
right, when you have that kind of data, and what we're looking for is, we thought we'd see it at the end of 2025, but it didn't materialize. We're looking for this comprehensive healthcare bill that's going to develop. Okay, the final funding bill for the world, so to speak, that passed at the end of passed earlier this year. It had some healthcare provisions in it. It extended telehealth for 3 years, hospital at home for 5 years, and added more money to federally qualified health centers. But they left a lot of things on the table. Okay, and so there's nobody doubts we're going to have a bill. The question is, how big can it be, and how many things can get in it? But the advocates on the nutrition side are pushing on MNT, with
MNT?
MNT, which is medical nutrition therapy.
Oh, okay.
The expansion of MNT, which is, by the way, it's a personalized disease-specific nutrition counseling that's done by a registered dietitian nutritionist. That's part of what MNT is. So not only are you getting counseling, you're getting personalized counseling, disease-specific counseling, on a prevention side. So you have that, and then you also have the treatment and Reduce Obesity Act, or TROA, TROA, its acronym up here is. And, that's really a place that we should look at for this reason. You know, as I mentioned before about nutrition being a lifespan issue, obesity has now become an intergenerational health issue. 2 in 5 adults are obese. More than a quarter of older adults are obese. And childhood obesity has doubled since 1990. So, having a bill that will focus on things like intensive behavioral counseling as part of obesity care. Um, the administration, to its credit, did say, we're going to tackle this at least this one way. We're going to expand coverage of GLP-1s, and make it more eligible under Medicare. But that's only part of what you really need to be doing. There's a lot of other things, and this bill, TROA, would do that, and it could also fit into a comprehensive health bill. But one of the things that, and I wrote a piece on health affairs with some of my colleagues in the nutrition space. We said obesity care plans are important, but if you don't have nutrition care written into them, you're not going to accomplish your goal. There has to be a connection between the two. And I guarantee you, as this process moves along, we will continue to advocate for that, to make sure that that's in there. And then, of course, you have, the Older Americans Act reauthorization. And again, nutrition is the biggest program in that. And there's going to be some follow up on the dietary guidelines. There could be some, movements and changes there. So, in some ways, and my colleague and I, Laura Borth and myself, wrote a piece, said that 2026 could be a nourishing policy year. And it was an Aging in America. And, we've gotten a lot of feedback from people who said, yeah, that could be great if we really focused our attention that way.
For sure. So, can you tell me again what TROA stands for?
Yes, the Treat and Reduce Obesity Act.
Treat and Reduce Obesity Act. So that already exists and is going through Congress right now.
Right. They've had hearings and both the House and the Senate. It goes it goes before the House Ways and Means Committee and the Senate Finance Committee. The medical nutrition therapy bill was just introduced recently. It will likely get some type of a hearing. But the end goal is, as a large healthcare bill is unveiled, everybody's gonna be knocking on the door trying to get their piece in. But I'm happy to say that the nutrition lobby, if you will, for lack of a better term, is getting more sophisticated. Look at registered dietitians as an example. My dear friends at the Academy of Nutrition and Dietetics, there's 70,000 registered dietitians in this country, but they're constituents, by the way. They're probably in every congressional district. And to their credit, the Academy does put their people to work doing grassroots advocacy, on their priority issues. And that's what everybody really needs to do. You got to drill these issues down. I've said and I've walked into these situations too many times in my life when I've gone in on a local basis and said to a senator or House member, where are you on X and Y? And they say, we're not hearing anything. We don't hear anything about that. That's the worst. That's the worst thing you can hear.
Yes. So we need advocates to be speaking up, talking to their legislators about this and saying, this is something I care about. I want you to address this.
Right. And if you have the benefit of data and a good human story, you package that into your request and you'll be listened to. Because, I've always said that no matter how complicated an issue is, the more you localize and humanize it, the more effective you'll be as an advocate. And in nutrition, it's so obvious that you can do that, because, like having gone to many, many congregate nutrition programs in my life to visit and see how the money works. Just sitting at a table talking to older adults is a lesson in itself. And I'll tell you a good example of this. So a few years back, my NANAS group, my nutrition group, we got a grant to study the value of socialization in the Older Americans Act nutrition program. And I knew that was an important component. It's written into the law, actually. It says the Older Americans Act nutrition program is to provide a meal, nutrition education, a socialization opportunity, and help prevent malnutrition, right?
Mm-hmm.
So I'm walking around, meeting these people. I sit at a table in Fort Wayne, Indiana. I remember this like it was yesterday. And I went table to table, and I asked the question, the same question. So, what's the main reason you come here when you come here, right? And everybody's going, to see my friends, socialization, whatever it is. But nutrition programs are like third grade. Everybody sits in the same place every day, right? And
Yes.
right, and
Don't take someone's seat.
that's right. And there's always a ringleader, at each table. So this one table I went to, which was the largest of the tables in this particular uh, center, there was one seat missing. And I said, okay, I'm going to come back when the whole table's full. And I come back and I say, well, I'm glad you're back. And, I want to ask you the same question that I just asked your table mates. And she said, well, young man, now that I trust you, I'll be happy to answer your question. I said, so what's the main reason that you come here? She said, like the rest of these people, we come here to gossip. I said, bingo.
Fair
That's
enough.
socialization, right?
That's right. It's really not just gossip. It's finding out what's going on in someone else's life,
Right.
trying to relate to it, right? Sharing about your own life. That's really important. And as we age, we can get more and more isolated because, friends and family move away or pass away. And it's more and more important to create some intentionality around that social connection. And
Yeah.
that's what the Older Americans Act Nutrition Program does, like you said.
Right. And the thing that was the saddest about it is what the pandemic did to the program is still being felt. In other words, before the pandemic, 2/3 of older adults in the Older Americans Act Nutrition Program were served in congregate sites. Now, when the pandemic hit, 95% ended up getting their meals at home, and
Right.
the struggle is to get them to come back. And it was a big process of getting these places, safe for them to come back to. But the data that ACL has is showing they are coming back. And the other thing, as you know, that makes them come back is if two things. One, if there's other activities beside the meal.
Yes.
And secondly, if they have choice in what they get to eat every week, right? Those two
Right.
things, those two things will give you a full house, and
Yes.
we all want to encourage that.
Right. Other activities to do. If you're going to go all the way out to get a meal, it's really nice if you can do some kind of activity afterwards as well.
Mhm.
And then the meal choice. And we have found that having culturally appropriate meals is really valuable to people as well. We've been trying to expand here at Age Guide in the Chicagoland suburbs our offerings of different cultural meals because meals are very personal to us, right? We grow
Right.
up with a certain kind of food, we love certain things, and when you start to struggle with cooking, that's such a big loss. So if we can address like the types of food that a community likes to eat, we get a much larger crowd, and we have found that to be really a positive way to bring more people in. Have you seen other things that work to kind of strengthen that social connection through nutrition?
Yeah, and I think some of it does have to do with what you're offering. I
Hmm.
remember visiting a place in Illinois, but I can't remember where it was. But it was a restaurant based program.
Hmm.
I forget what nationality it was, but they sold that it was once a week they would go to this restaurant and eat the food, and it was I went there one day and they were just the closeness was so obvious because they knew what they were eating, right? They just kind of like it felt like a family event type of thing.
Right.
So clearly, culturally appropriate is very important. Choice is very important. You know, looking at having what they call the cafe model sometimes can also be good.
Hmm.
How it's presented, how it looks, um, and and if you have nutrition education at the same time, like in our work with NADAS, like for example, when it gets to be open enrollment time for Medicare, we try to bring educational materials that they can have right on their tray and read as they're eating, or put it in a brochure when they go do a home delivered
Hmm.
meal. Um, so things that are important to them, like vaccines, for example, we always urge that to happen. So the more there's things beyond sitting down to that meal, the better things will be. Um, and of course, sometimes we undersell the importance of the staff. You know, I mean, you all are trusted entities. You have the benefit of being, even more so than a doctor sometimes. I mean, because you're a daily presence, right?
Hmm.
And
Embedded in the communities.
right,
Right.
exactly. So, and you know, I know sometimes time constraints can limit the amount of time you can interact with each individual that comes, but just the very fact that the same people are there and you can get a hello from somebody and or whatever, it means a lot. And that's a lot about the socialization part of the whole thing.
Yes. So important. So, zooming out a little bit, you've spent all these years helping people understand how decisions in Congress ripple down into the daily lives of older adults. And you mentioned a few positive things that we can look toward in 2026. Is there anything else that we should be watching, keeping an eye on this year on the nutrition front?
Well, I think we also have to contend with some bad things that have been put forward that we would like to see remedied, such as the changes that were in the HR1, in
Yeah.
particular, the imposition of work requirements in the SNAP program and raising the age for work requirements from 54 to 64, which,
Hmm.
we've already seen a 2 million person decrease in SNAP participation between November 24 and November 25. This is before these provisions kick in. So I think what people have to do is understand that they need to document what's going on, what the impact of these cuts are really happening, on a
Hmm.
person by person basis. Okay. And because, I saw a statistic about how many households in SNAP are headed by people 50 and over, and it's quite a few. Okay.
Hmm.
So getting enough data and stories to allow for possible changes in HR1 around Medicaid and around SNAP, I think is going to be very important for people to do.
Hmm.
Um, and at the same time, some of the things that are being talked about to improve the quality of food offered and reimbursed by SNAP would be important for people to advocate for. Um, but any program that's working, should be allowed to continue and grow. And of course, the Old Americans Act jumps out at me as being the prime example of that. The return on the investment for that program over its 60 years is remarkable. Okay, I mean, my colleagues at Meals on Wheels America talk about for the cost of 1 year of the cost of a year's worth of home delivered meals is equal to 1 day in a hospital and 10 days in a nursing home. I mean, what else do you need? The data's right there, right?
Huge cost savings. The
So
return on
I
investment
would
is
think
great.
that I would think from a priority standpoint for older adults in particular, since the nutrition program is the largest program in the Old Americans Act, all of our attention should be on getting that thing over the finish line. Number one, and number two, get it adequately funded so that it can, because one of the things, and you'll notice this if you haven't already, which is because of those changes to Medicaid and to SNAP, OAA programs are going to see a lot more people.
Older Americans Act programs,
Right, because
and it needs to be reauthorized. That's what you're referring to, the
right,
reauthorization. Yes.
right, and because your demand's going to grow simply
Right.
because these people who may have not known who you were before, but all of a sudden they're aware of your existence
Mhm.
and what they were used to having isn't there. It's just logical they're going to come your way, and we need to know that from a documentation standpoint, so that when we go out and make our appeal for more money, we can point to the increased demand that's come about. Um,
Mhm.
so those are, I mean that, and the bills I talked about, the TROA and MNT, if we can get those over the finish line, and do some more work around, the dietary guidelines and make them, more older adult friendly. I think we'll have a good year if we can get those things done.
That would be wonderful. And you mentioned, the work requirements. I think we're really concerned about that expansion of work requirements down to 50-year-olds. And you think about it, you're like, well, a lot of 50-year-olds are still working. They should be still working. But when we're talking about people who are food insecure, there's a reason why a 55-year-old might not be working. And often it's because they're a caregiver, right? They're
Right.
caring for a spouse or a loved one or an adult child with a disability, and they can't work. And that is why they're needing the food stamps, why they're needing the SNAP program. And asking them to work is going to put not only them, but also the person they're caring for at risk. So now you're talking about two people's lives and two potential expenses, if people were to go in the hospital or into long-term care, like you said. That's really the age group that I'm most concerned about because I feel like there's a lot of caregivers in that group. And there are also grandparents raising grandchildren in that age group. We've got a lot of those that we work with here in our area.
Well, I do know that some great advocacy work led by the National Alliance for Caregiving and a bunch of other groups have signed on going to CMS and saying, and to the Department of Agriculture, saying, what are the caregiver exemptions here? Okay.
Yes,
And,
good.
and there apparently is some guidance that's going to be coming out
Oh,
in the near
wonderful.
future. And I'll be happy to share it with you when I see it
Please. Yeah, that
because
would be wonderful.
you raised a very obvious point that a lot of people are aware of. And with 63 million caregivers in the United States,
Mhm.
you know, we can't let that. Um, we can't be doing things to make their jobs harder. We
Exactly.
should be doing more to help them along. I mean, we only
Right.
have one federal program that really dedicates itself to family caregivers, which is in the Older Americans Act, but
Mhm.
it's only what $150 million for the whole country.
Right.
What we need, and you know this, is a family caregiver tax credit. Okay, that
Yes.
recognizes the fact that it costs money on a daily basis to care for someone. And if
Right.
you can get a tax break for everything under the sun, as a multi-billionaire corporation, you know, the family caregiver is entitled to the same thing. So if you have an advocacy component to this program, tell
Mhm.
people they should be pushing every day their legislators to get a family caregiver tax credit done. And it's ironic because the president of the United States called for that in his campaign. The Democratic nominee called for something like that in her campaign. So there's grounds for that to happen, but now we got to get the political will to bring it over the finish line. And there will be a tax bill coming next year, and that may be the opportunity.
So, finally, before we end, what is one thing that you would recommend that advocates who are listening today, what would you recommend that they do to help shape what comes next in nutrition? If you could just tell them, just do this one thing for now.
Well, first I would say is be an advocate. Okay. I mean, don't think it's somebody else's job. It's
Oh,
just as
good
much
one.
your job.
Yeah.
And also remember that advocacy is a contact sport. Okay. You don't make progress unless you make contacts. And you need to build your contacts however you can go about doing it. Through friends or family organizations, joining groups. Um, know who your elected people are.
Mhm.
And even more so, even more fundamentally, my friend, my colleague and your friend Sandy Markwood from US Aging, she and I have been doing a lot of presentations together. And we came to this realization one day we were walking through a senior center, I guess it was, and it was during lunchtime. And we realized because we went up to 3 or 4 people and said, which federal program gives you your meal?
They didn't know.
They did not know.
They didn't know. Right.
Okay. They need to be educated on that, man. Because if
Mhm.
you can say as a participant in a program, I value the Old Americans Act because it does provide me my meal. And this meal means that, these kind of small, compact messages complement anything we can do. Okay.
Yeah.
Look, I worked in the House of Representatives staff for a long period of time, and I'd see the advocates come in or lobbyists come in. I know what you're going to tell me, right? But when they go home, and all of a sudden they're confronted in a town hall or a Rotary meeting or whatever it may be, and somebody says, "What's this about you cutting my meal out from the Old Americans Act?" Well, then all of a sudden,
Mhm.
so people should take every opportunity to present whatever it is that concerns them, okay, and make sure it
Mhm.
communicates it to the people making decisions. So, and the more people who do this, the better off I think we're going to be.
That's very good advice, and we definitely saw that here when there were some proposed cuts to Older Americans Act funding, and the department was being cut and dismantled, and we did a lot of advocacy work, and all of a sudden we realized we needed to let people know which services were Older Americans Act services that they'd been enjoying for a long time. And I think folks were kind of surprised to learn that. But older adults are excellent advocates for these programs. And once they knew that it was the Older Americans Act that was being threatened, we built some wonderful advocates who went out and spoke. They did marches, they did celebrations, they talked to their legislators. So it really is important to do that education around
And,
Older Americans Act.
add to that, not only older adults, but people who volunteer on behalf of older adults. I mean,
Right.
you
They're
know,
passionate about what they do. There's a reason why they're spending their time doing that.
sure, and I've been honored to be on the board of ARP for the last 9 years. But before I was the volunteer state president of ARP in Virginia. And just like my friend Rosanna Marquez, who used to be the state president of ARP in Illinois, when you have your lobby day in the state legislature and they all wear the red shirts, okay, those things, little things like that, when the red shirts come after you, you better be ready, and you better have the right thing to say, or you're going to hear from them. And so, I think that's what people have to do, is to get active, and because silence is complacency, and that's not good.
Mhm. Mhm. I love what you said about advocacy as a contact sport. That's so true. You gotta get out there, you gotta meet people, you gotta talk to people, you have to pick up the phone and call your legislator.
Right, and the other thing I'd add, and you could pass this on as well, is that when time comes to go voting, you know, people need to vote in their best interest, not
Yeah.
with their best or worst instinct. Vote for your best interest, for your interest, your family's interest, whatever it may be. Who is going to take the right approach to the issues that you care about, and learn and listen to what they have to say, and then make your judgment based on, what is in my best interest to have represent me in X or Y. So.
Good point. Thanks for leaving us with that charge, that call to action, Bob. It was wonderful speaking with you.
Well, thank you for inviting me, Gretchen. I look forward to seeing you hopefully in the course of the year.
Yes, so we look forward to it.
Hello and welcome to your Medicare Minute. My name is Val Guzman and I'm the Benefit Access Specialist here at Age Guide. Medicare beneficiaries can have access to a registered dietitian that would help support your personal medical goals. Medicare covers nutrition counseling through medical nutrition therapy services. Medicare's nutrition therapy services include a nutrition and lifestyle assessment, individual and group therapy services, help managing lifestyle factors, and follow-up visits to check on your progress. Medicare does set some eligibility requirements for nutrition services, so it's important that you speak with your doctor first. For more information on other nutrition programs, visit ageguide.org or call us at 1-800-528-2000.
Thank you for joining us on The Age Guide, where we explore the insights, experiences, and practical strategies that help us thrive as we age. To learn more about how Age Guide Northeastern Illinois is advocating for older adults and caregivers, visit us at ageguide.org or call our offices at 630-293-5990. And if you enjoyed this episode, please share to help others find us. Join us next month as we continue exploring what it means to age well.